Today we are going over the cardiovascular system. The main organ in the cardiovascular system is heart, which is located in the thoracic cavity within the mediastinum between the lungs. The system is responsible for carrying blood through different regions of the body, delivering oxygen and nutrients and removing waste product. In this unit we will study heart, blood vessels and blood, which together make up the cardiovascular system. The heart has 4 chambers. We will discuss the valves, pathway of the blood flow and type of blood, oxygenated or deoxygenated, that flows through each chamber. This is the external anatomy of the heart, and we are looking at the anterior front surface. The heart's main function is to pump blood throughout the body, delivering oxygen and nutrients to tissues and removing carbon dioxide and other wastes. On the anterior surface, you can identify major structures such as the right and left ventricles and the great vessels that carry blood to and from the heart. This is the posterior back surface of the heart. On this side, you can see where major blood vessels enter and exit the heart. For studying for that chambers, I take it out this anterior portion. You can see inside the chambers. This is the right side of the heart. This is the left side. How do you can identify? One way you can identify the right side, this muscle, if you look at that, is smaller compared to that left side. So this is a right side, this is the left side. Right side is a thinner muscle, left side is a thicker ventricular muscle. So these are 4 chambers. This is a right atrium, this is a right ventricle. Moving, this is a left atrium and a left ventricle. Blood coming from that is superior vena cava and inferior vena cava to that's a deoxygenated blood, blue color dark blood vessels. When you see, that's a mainly deoxygenated blood carried through that. So deoxygenated blood, that means the lack of oxygenated blood coming into that right atrium. From right atrium to right ventricle, then it will go through that pulmonary trunk to the pulmonary artery to the lungs. So lungs, what is the main function? Main function of the lungs is exchanging that carbon dioxide and oxygen. Once that exchange happens, oxygenated blood will come through pulmonary vein to that pulmonary vein to that left atrium. From left atrium, it will go to that left ventricle. Then that big contractions, a big pump, the blood will go for a systemic circulation through aorta to that all over the body. So that is the reason it's a big push, because the blood has to go to all over the body. We need a big push, I believe. So this is what, that's the reason. This is what, this muscle is thicker compared to that this muscle. When you contracting this left side of the ventricle, it's only go to what, lungs. So lungs is nearby, it's not too far. So this that's the reason this portion is less thicker compared to this one. Then we're going to see that some of those valves. These valves we called atrioventricular valves. Atrioventricular means in between atrium and ventricle. right side, this is actually tricuspid valve. Left side, this valve, this is atrioventricular. In commonly we say that other specific name for the left atrioventricular valve is a bicuspid valve. Then you see semilunar valve. Lunar means what? Moon shape. So this is a semilunar valve, which is a pulmonary. It's going for that pulmonary circulation to that lungs. Pulmonary valve. Then this one semilunar valve, which is this one you can see over here, going from that left ventricle to that aorta for the systemic circulation, which is a aortic valve. Aortic valve, and this one is a lunar semilunar valve, the pulmonary valve. These two are what? Atrioventricular valves, tricuspid and bicuspid. That's the structure we studying. Then we're going to see few things, so make sure you study from this this handout. Everything in this handout going to be on the exam. Okay, then I want to go explain a little bit from here. This is a layers of walls. There are 3 layers. We're going to see that anatomy. So mediastinum is where that heart is located. I showed you that base appendix. Apex, not appendix. Apex is a pointy part of the heart. This is a base of the heart. Pointy part is what? This is a pointy part, apex of the heart, base of the heart. There are layers, epicardium, myocardium and endocardium. Epi means what? Around. This is a epicardium. Around that heart there should be a, when you dissect you can clearly see that that is also visceral pericardium. That's a covering of the heart. Then this muscle portion of the heart wall, which is called myocardium. The inner layer, this membrane, which is endocardium. Endo means inside. Endo, myo and epicardium. The chambers I already mentioned. That septum, which is, this one is a interatrial septum. This between that, this one, in between the model you don't see clearly, between the atrium, which is a interatrial septum. Septum is a wall. Then interventricular septum, in between 2 ventricles, right and left, which is a interventricular septum. So I mentioned this, the word anterioventricular valves, tricuspid, bicuspid. Bicuspid, other name is a mitral valve. Then semilunar valves, pulmonary valve and aortic valve. Then pulmonary, that papillary muscles. Papillary muscles are these number 4 they mention here. There's a papillary muscle which is connected to that caudate tendinae. Caudate tendinae is the one, this string-like structure on that AV valves. So these are what? Caudate tendinae. It's like a string-like structure which is connected to this muscle. Is a, you can see over here, this is a columnar shape. This one, this is a muscle. This is a pulmonary muscle. This is a caudate tendinae. Then another thing is trabeculae carneae. Inside the ventricle compared to that atrium, you can see that a lot of foldings and rough. This portion we called caudate. Trabeculae carneae. Trabeculae carneae is this rough foldings inside the ventricle. What else? Coronary sinus, which start over here you can see that tip of that arch, ascending part of that aorta, the starting over here, which is a coronary circulation, is for what? Feeding the blood to that heart muscle. There are three different types of blood circulation, or so coronary circulation, pulmonary circulation, and systemic circulation. This is pulmonary trunk. Pulmonary arteries carry blood away from heart to lungs. Whenever here arteries definition, they carry blood away from heart. Veins bringing the blood to that heart. So here this is ascending aorta, aortic arch, then descending aorta. Fossa ovalis, you cannot see this portion over here. You can see ligamentum arteriosum is a remnant at this moment. Is not is a functional structure. Should be over here. This is the one that fossa ovalis over here in the right atrium to left atrium. It was opening. It will close when you take that first breath. If you don't close it, then you have surgery needed. What else? Then conduction system. This one is not clearly explained this model, but I can explain. Conduction system is the one that the electrical signals are carried through that heart to pump the heart. Somebody need give the signals. So this sinoatrial node should be in this is atrial wall. I will show you maybe different picture for that one later. This is atrioventricular node. This is in between the atrium and the ventricle. So over here, then that signals go through that atrioventricular bundle or bundle of His. Then it will go to that move through that one. Is going for the left bundle branch and right bundle branch, and it's a turn around is become that Purkinje fibers. So it's going to be conduction system going to be SA node, AV node, atrioventricular bundle or bundle of His. Then become the right and left bundle branch, then the Purkinje fibers. That's a conduction system. That's about the heart. So this left side, the right side carry deoxygenated blood, left side carry oxygenated blood. If you have any questions, please let me know. Thank you for watching Science with the Doctor. Don't forget to like, share and subscribe, and feel free to leave a comment if you have any questions or concerns. I would be happy to help. Study it till it sticks.